Hi, I'm Linda D. from the Fair Pricing Coalition, and I'm with my colleagues Jeff Berry, Dave Evans, and Murray Penner. And we would like to start by saying we have another video that tells you a little bit more about what the Fair Pricing Coalition does with respect to drug pricing and drug price increases with all the HIV drug companies. But today we want to concentrate on another aspect of the work we do, and that's access and how people that need drugs and can't afford them can get them and access them from companies. And that's if you have insurance and can't afford your copays, or if you can't afford drugs at all, don't have any insurance, or other instances of just needing help. So with your drugs, that is. So without further ado, let's talk to Jeff first about copays and PAP, patient assistance programs for people with HIV.
Sure, thanks, Linda. So so many companies, most companies have some programs that offer some form of assistance for insured folks. That comes in the form of copay programs, and individuals get a card and they can get it from their provider. Now many times on the website they can just print it right out, and then they take this to the pharmacy and it'll cover their copay up to a certain amount, sometimes at $100, $200, $400 per month per prescription. And that will help alleviate obviously some of the rising costs that their patients are seeing with their copays. For uninsured and underinsured individuals, there are patient assistance programs. These are for people who don't qualify for any type of governmental assistance, except there's an exception that David will be talking about a little bit. And these will cover up to a certain amount, percentage based on the federal poverty level. And many of them are like at about 500% of poverty level. So that will offers if they qualify. So then if they qualify at that level, they'll get the drug free of charge. And so that has really helped with access for these medications. And this is not only HIV, but HCV and many other medications. So always check to see with your pharmacist, your provider, if these programs are available.
You know, we've worked really hard to try and get all the HIV companies to participate in these programs, and they do, but they're not often completely transparent with what it is they cover and whether or not you are eligible. So if you go to a website, and you can look on our website and you can see how you can access the different information from the different companies. If you go on their websites and see, 500% of the federal poverty level, or if you see something that makes you think, well, this is not me, I'm not eligible for this program, call anyway. Get in touch anyway. What they don't tell you is they make exceptions. There's appeal processes for a lot of these patient assistance programs. So, you just really have to get in there and fight for yourself. And you can usually get the assistance that you need, but just don't look at it and give up because it looks like you're not the kind of person that is eligible for any particular program.
Murray, didn't you want to talk a bit about a different way of accessing these patient assistance programs?
Sure. So one of the challenges with accessing these different patient assistance programs is if you're on 3 or 4 different medicines and they're produced by different companies, you have to go through each company's specific process, and every company has a different process. So some of them require a few different types of documentation for your income, while others will require something different, and they have different forms and they have different time periods during which you're eligible, and you get your medicines via different mechanisms. Sometimes you get them in the mail, sometimes you get a card and you can go to a pharmacy. So the challenge with that is that if you have multiple programs to which you're applying, you really sometimes encounter roadblocks. So one of the things that we've been working on with a couple of different partners, one is developing a common form that allows an individual to fill out one form that then can go to any one of the company programs or several of them with the same form. So you fill it out once. You still have to turn the form in separately to each company, but you have an option to just fill out one set of paperwork versus 3 or 4 or however many you might have. So that's considered the HHS common form, or the common HIV patient assistance program application form. It was developed in conjunction with HHS, and it really does streamline the opportunities to apply for programs. The other application, or the other challenge that sometimes is experienced, is not just with the applying, as I mentioned earlier, it's sometimes with how you get your medicines or coordinating the time periods during which you're eligible. Another entity is now under operation. It's called HarborPath, and HarborPath provides a common portal where you can input all of your information in terms of the application and then get all of your drugs at the same place through one mechanism versus having to go to several different places. Right now, HarborPath is in a pilot phase. ViiV and Merck are two companies which are participating, so right now you can only get ViiV or Merck drugs through that process. We hope that other companies will be coming on board. We've been asking them to. And as soon as other companies are on board, those medications will also be available through this process. So it really streamlines the application process as well as the prescription fulfillment process on the back end. So how you apply and how you get your drugs are all pretty seamless versus having to go to several different places.
And that's for ADAP waiting list patients?
That's for anybody currently. The other process that is in place, which is similar, is right now through WellVista, and that allows anybody who's on an ADAP waiting list to get their medications via the same process, basically one application in and one receipt of all your drugs. That is in the process of transferring to HarborPath. HarborPath will be administering that program soon. And so if you're on an ADAP waiting list, that's the place that you would need to go, and your ADAP case manager or administrator will know the details about that.
And maybe you can talk just for a second about NASTAD, and you're from NASTAD, about how NASTAD is in touch with the different ADAPs so that people that might not be aware of this kind of stuff can deal with this right through their ADAP offices.
Right. So I work for the National Alliance of State and Territorial AIDS Directors, or NASTAD, and we support state ADAP programs in their administration of the programs. And one of the things that we've been working hard at is making sure that all ADAP case managers have this information, both for the individual company programs as well as the Common Form and HarborPath and WellVista, so that when somebody is not eligible for ADAP for whatever reason, or if there's a waiting list, the case managers know where to help people access their drugs. So if you're not talking with an ADAP case manager, you definitely want to be doing that if you're applying there and trying to get your drugs through that mechanism.
Because we know that even though we've tried to simplify this stuff, when you're talking about three companies and three forms, even if there is one form, people might not know about it or how to get it or where to get it, so if you can talk to your ADAP case manager, I think that it would probably be very helpful to people to try and sort all this out. And just like anything in life, once you do it once, it's much easier.
And we do have all these resources on the Fair Pricing Coalition website.
Right.
So please, if you're looking for them, you can go to our website and you can be routed to the various places that we've been talking about.
So next, let's hear from David Evans about a new aspect of something that we're involved with as far as access is concerned. People on Part D and people with insurance, who we think that category of people is also very important. In years past, we've dealt with people on AIDS drug assistance programs for the most part, but we all know that things are changing and that insurance costs more, that there are high copays, oftentimes co-insurance, sometimes caps, and we want to be sure that everybody has access to these drugs for HIV, HCV, and HPV, and not just, Anyway, so let's let David discuss that.
Sure. Well, there are a couple of limitations to the current copay and copay programs. One of those limitations is for people who have Medicare Part D. And if you are in Medicare and you have Medicare Part D, there are two ways that you pay out of pocket. One of them is in copayments when you go to the pharmacy, and the other is that once you've spent up to a certain amount of money, there's what they call the donut hole, where your coverage stops for a period of time until you've spent a certain amount of money, and then your insurance kicks back in again. Right now, the copay programs cannot cover any government health insurance recipients. So that means that people with Medicare Part D cannot get assistance either with their copayments or during the donut hole to help them make up that cost. The donut hole is shrinking and will continue to shrink because of the Affordable Care Act in the coming 10 years, but it's still fairly significant. It's up to $500, and that's a big chunk of change to come out of somebody's pocket. So one of the things that we're working on as an advocacy strategy is asking the companies to make a donation to a copay foundation. These are private, nonprofit foundations that have been set up to help people who have Medicare Part D. And they're in place for hepatitis, they're in place for other rare diseases, and there's no reason that they couldn't be in place for HIV as well. So we're asking all of the companies to donate to a foundation like that, and that would help people not only with their copays, but also during that donut hole phase. Another real limitation that we're finding to the copay programs is that increasingly people are having something called pharmacy deductibles. And what a pharmacy deductible is rather than a copay where you go in and you have to pay $50 or $100 or $150 for your medication, you actually have to spend up to $1,000, $2,000 out of your own pocket before your benefits even start to kick in. And right now the copay programs do not cover pharmacy deductibles. It's not a really common problem. Not a lot of people have it, but a growing number of people do. And one of the things that we're concerned about is that even with the Affordable Care Act, which is going to broaden the number of people with insurance, there are starting to be some signals that the amount of sharing of cost that people will have to put in out of their own pockets may be quite high. And so we're worried that the current copay programs actually aren't going to be sufficient to help people who need it.
And so it's been really interesting to find out when we brought some of these new initiatives up to the companies, lo and behold, well, you know, we actually do cover some of that stuff. So it's really funny, when we first started doing this work, the companies weren't very transparent about the PAP and the patient assistance programs and the copay programs and what they did cover and what they didn't cover. And it turns out that they're covering all sorts of things that that they haven't been forthcoming about. So I think the lesson here is to just keep fighting, keep calling, keep asking for exceptions, because there's all sorts of things that they cover that you wouldn't know about, that we didn't know about. So I think it's important to not give up, to not say, throw your hands up and say, this is all too much for me. There's help there. Again, as Murray said, look at our website. There are other resources there that help help people to understand these complicated issues. But and if all else fails, get in touch with us, and we'd like some evidence from you that things are not going smoothly for you, or things are not being covered, and we'd be happy to bring those back to the drug companies and see if we can help you get through this maze.
And just to echo what Linda was saying, so if it's not uncommon for someone to apply for one of these programs and then get turned down, and then if they appeal it, to then get accepted. So we really encourage people, if you get turned down, appeal the decision and try again.
Yeah, one of the things I'll add too, and it sort of relates to what David was talking about earlier, where you were talking about the large donut hole expenditures or whatever. There are some companies, as Linda said, that in their patient assistance programs, not in their copay programs, but in their patient assistance programs, they might cover some of that. And we have been able to get some people exceptions. And that's what Linda was talking about earlier. That's been frustrating, because you don't see that when you look on the website, that it might cover, you know, a certain exception. So as David said, it's important to continue to apply and really try to get in there.
Yeah. So again, there are exceptions to the eligibility criteria. There are appeals from denials. Just don't give up. Keep trying, and let us know if you're not having any luck, and we'll be happy to bring your case to the companies and see what we can do to help you.